Hello, I am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center, EOC, for another update on the situation regarding the novel coronavirus, COVID-19, here on Nevis. I want to take this opportunity to thank all the media houses that have joined us today virtually, and I also want to thank all the presenters who will be making their updates today. All questions will be taken at the end of all presentations. The Nevis COVID-19 EOC briefings will be aired on Mondays and Thursdays each week at 8 p.m. on Nevis TV. You can also check the links for these briefings on the YouTube channel for Nevis Television and Nevis Disaster Management, and you can also check the Facebook pages for Nevis HPU, Nevis Disaster Management, and Nevis Television. Today we have with us the Honorable Mark Brantley, who is the Premier and Senior Minister of Health and Gender Affairs in the Nevis Island Administration. We have Mr. Brian Dyer, who is the EOC Director, Dr. Judy Nisbet, who is the COVID-19 Task Force Chair. We have Superintendent Lyndon David for the Royal St. Kitts and Nevis Police Force, Nevis Division. Ms. Chanel Mills, Assistant Hospital Administrator, Alexandra Hospital. Ms. Sandra Maynard, Director of Social Services Department. And Mr. Huey Sargent, who is the Permanent Secretary in the Ministry of Agriculture, et al. And I'll give over to the Honorable Mark Brantley, who would give his updates and remarks.
Good afternoon and welcome to another edition of this briefing that is being done here at the local level at the Nevis Emergency Operations Center. I'm delighted to be here again to speak to the general public and to continue to encourage the work that is being done here to keep our island safe. I want to start, as I always do, by thanking Dr. Nisbet, Dr. Judy Nisbet, the head of our local COVID-19 task force, and the entire team. I also want to welcome Dr. Elizabeth Oliver Correa. I trust I got that correct, who is an epidemiologist who has come from Cuba. And I want to extend our thanks to her and her government for not only sending her, Dr. Correa, but also sending 5 specialist nurses who are working here in Nevis. As we all know, they, consistent with protocol, had to be quarantined. They're now out of quarantine, and Dr. Correa has joined our EOC. So welcome to you. If I could say it in Spanish, I would, but I'm saying it in English. Welcome. It is good to have you. So we are very happy to have our Cuban friends here with us, adding to our ability to respond. I would wish to continue to express appreciation for the fact that of the 4 cases that we have confirmed in Nevis, I am told that they're all in good health, and that no one in Nevis or indeed in St. Kitts has been hospitalized as yet as a consequence of COVID-19. So that's a good sign, and we're hopeful that that will continue. We have the 4 cases in Nevis. We've had no reports of any further positive cases as at this point. And we are hopeful, of course, that we can keep numbers to a minimum. In the interim, we are inviting our people to continue to be responsible, to continue to be disciplined, to continue to wear their masks if they're out in public, and to stay at home if they have no need to be in public. We recognize that today and tomorrow are shopping days. The island has been zoned. Zone 3 should be out today shopping, and Zone 3, the parishes of St. Paul, St. Thomas's, and St. James. Nobody else should be out shopping today, only Zone 3. Tomorrow, Zone 4, St. John's and St. George, they get their opportunity, and Zone 3 will be expected to stay at home. The idea is to limit the numbers of persons. I'm delighted that the police have been doing their part. They are even now deployed at the supermarkets to try and ensure that we keep order. I would urge our people, however, that there's no need for binge shopping. We have enough food. We have food that's coming in from overseas as normal, and we have our own local production has been ramped up. But in addition to that, Monday and Tuesday are expected again to be days that we can shop. And then Thursday and Friday of next week are again expected to be days that we can shop. So I don't think there's a need for us to do any binge shopping, to shop as if we're going to be on lockdown for the next month, because that is not the case. Clearly, based on the numbers and based on the advice that we've had, we are seeking more and more now to see what we can do in terms of a gradual relaxation. I emphasize gradual, and I say to our people that the word that I'm using is caution, that we have to be cautious. I think the World Health Organization has indicated that all of us, have to be fearful of a second wave of infections. China, I am advised, is now experiencing that phenomenon. So we have to be very careful to learn the lessons from others and not to seek to resume normalcy too early, lest we have another wave of infections. And so we are going to continue to do the best that we can with the technical advice that we have and make the right decisions. In the interim, I simply want to say thank you. Thank you to the COVID-19 task force here. Thank you to those at the federal level who have also been doing an excellent job. Thank you to our police and the security forces who are on the front line, our health workers, our sanitation workers, our water department and NEVLEC and all of these people who are, even in this difficult time, helping us to maintain a sense of normalcy. I thank them. I thank you for your service, for your commitment, and I continue to urge all of us to remember that we are in this together. And together, working together, we shall and will overcome this. I am hopeful that in the very short future, in the very near future, we'll be able to look back and say that this was a bad period in time that we've now put behind us. Let us continue to work together. Let us continue to heed the warnings and the instructions. Let us continue to stay at home. And whilst we are at home, to practice good hygiene, washing our hands, coughing in our elbow, all the things that we've now learnt. Let us continue to practice those things. And let us ensure that when we do go out, we practice social distancing and stay apart at least 6 feet. And, of course, try to wear masks or some face covering. I think that those are fairly easy things to comply with when we think about the consequence if we don't. And so I'm encouraging one and all, let us comply, let us be disciplined, and let us be responsible citizens. Thank you, and God bless you.
Thank you, Honorable Mark Brantley, for your remarks and for encouraging the population to continue to try their best and to remember the measures that we are advising persons to take so that we can stop the spread of COVID-19 on the island of Nevis and by extension the Federation. So social distancing, that should be the next thought whenever you're among persons. Washing your hands should be the next thought whenever you do any activity, etc., etc. So I would like to take this opportunity to welcome Mr. Brian Dyer, who is the Director for the Emergency Operations Center, EOC, to make his updates.
Good afternoon all. The Nevis Task Force met on Tuesday 14th with the Nevis Division of the Chamber of Industry and Commerce and discussed several strategies with regards to improving the shopping experience on Nevis during the periods of relaxed curfews. And we would like to appeal to the general public to adhere to the new initiatives that are being implemented by our stakeholders, the Chamber, as we try to ensure that we maintain the social distancing and order as prescribed by the police force and the Ministry of Health in this dynamic situation. With regards to our social services, I want to thank those persons in our communities for patronizing the social services. The report from the director indicated that they had some 57 calls yesterday, so I am happy that our persons are reaching out for some assistance, whether it be for psychosocial counseling or for receiving food or care packages. I want to say a special thank you to our general population. A note from our Registrar General: funeral directors requesting services of the Registrar General Office for registration of deaths or permits for burial are asked to call cell phone number 663-6302 for assistance. That again, for funeral directors requesting services for registration of death or permits for burial, you're asked to contact 663-6302. And finally, I'd like to say a special thank you to Mr. Sunshine Lauren Keynes and Mr. Dion Daniel, who provided the lunches today for our emergency services and essential workers. We also like to say a special thank you to the other prospective donors who have indicated a willingness to support the EOC operations and essential services. Your support are timely and well encouraged as we continue our best to ensure that we are well nourished while we work through this stressful period. Thank you very much.
Thank you, Mr. Dyer, for your updates in regards to the community response and all who have contributed, sponsored, and all the information or contact information needed for persons to seek assistance of various kind. I'll now ask Dr. Judy Nisbet, who is the chair of the Nevis Task Force, to make her presentation.
Good afternoon to everyone. As we are aware, on Saturday, March 28th, we welcomed a contingent of healthcare workers from Cuba, 1 doctor and 5 nurses. We wish to thank the government and people of Cuba for their generosity, even in this difficult time, in the time of a pandemic, and for making this possible. They could not have joined the staff at the Ministry of Health immediately on arrival, since they were placed in quarantine, just as all the other travelers have been. So they have been in quarantine for 2 weeks. They are now out of quarantine, and we welcome Dr. Elizabeth Oliver Correa to the health team here at the EOC and the 5 nurses at the Alexandra Hospital. Dr. Correa is the lead for this team here on Nevis. She's an epidemiologist and will assist us greatly in organizing and analyzing our data as it relates to COVID-19. At hospital, we have placed 5 specialist nurses, 3 who are specialized in emergency room nursing, and 2 in intensive care nursing. We have therefore increased our human resource capacity to respond to any surge in cases, more especially in the management of severe cases. Even though we would really hope that we don't get severe cases, but if so, we have the staff and the capability for this eventuality if it occurs. It will be an opportunity for our nurses to work alongside their counterparts and exchange knowledge also. So we welcome our counterparts from Cuba as we continue to prepare for the COVID-19 response. At this time, I'd like to invite Dr. Correa to the podium and just to say a few words.
Good afternoon, everybody. Nos sentimos halagados del recibimiento que tuvimos desde hace 2 semanas que llegamos. Estamos muy agradecidos al pueblo de Nevis, a las instituciones, a todos los dirigentes de este país. Nosotros venimos en ayudarnos en cuestión de contener esta epidemia. Somos especialistas de epidemiología. Nuestra especialidad sobre todo ayuda a controlar la diseminación, la distribución de las enfermedades y sobre todo ayudar en cuanto a la estrategia de contención de la enfermedad, tratando de que existan menos casos y una distribución adecuada con todos los contactos que existen.
So in general, she's saying that they're very grateful for the welcome that they've had from everyone here. They're happy to join the team. They will be taking part in controlling the outbreak. Mm-hmm. They are also... Okay, so they're going to also help in the planning and the daily preparation of interventions and the study of populations in this outbreak.
Yeah. Estamos para ayudarnos. Todos tenemos que contener la epidemia en los países que hemos sido asignados. En estos momentos Cuba tiene en 17 países colaboración para ayudar a todos en la contención de este virus que ha arrasado a la comunidad de todo el planeta.
Cuba have a number of missions going on right now in other countries to help those countries in the control of this epidemic, and so they will continue to do what they can to assist.
Vuelvo a reiterar el agradecimiento a todos en nombre mío y de mis compañeros que llegamos hace poco. Hoy fueron presentados en el hospital y vamos a comenzar a laborar en todo lo que nos necesite.
She would like to express again her gratitude on behalf of the other members of the team to the government and people of Nevis. Today they were able to go to the hospital to see where they will be working, and so they expressed their pleasure in all that's being done right now.
Vuelvo a reiterarle a la población, muy importante, que sigan todos los consejos que se dictan a través de la línea de ayuda de la COVID, que sigan todos los planes de lavarse las manos, que lo importante ahora y lo único que se sabe de este virus son las medidas preventivas, lo más importante para eliminarlo, como lavado de las manos, toser con el codo y todo lo que está escrito dentro de todas lo que se ha regulado.
Right, so she's saying that she would like to stress also the prevention measures that we've been speaking about since the beginning, since the onset of this epidemic. That is to continue washing your hands, to cough in your elbow, sneeze in a tissue and discard, and all the other information that health promotion and our health department have been putting forward in this outbreak.
Yeah. Gracias.
That's it.
Thanks.
Thank you.
Thank you, Dr. Correa, and welcome. We turn now to the statistics for today. So far, we have tested 75 persons here on Nevis. 56 negative results. We have gotten 4 positive results, and I want to stress that all the confirmed cases continue to do well. We have 15 tests pending. We have 61 persons now in quarantine, and we have released 142. I want to turn to another topic because today we have a partial curfew day, and then tomorrow we also have a partial curfew day. And I would have passed the supermarkets on the way here this morning. And while I saw some persons adhering to the social or physical distancing, I am a little concerned about the crowding that I saw in some areas and the lack of the physical distancing. What persons need to understand is that we now have to adjust to a new norm. It's not business as usual. Keeping some distance between each other, and also, along with all the other measures you have heard about, wearing a mask when you're in public spaces, especially in places like supermarkets and so forth, washing your hands frequently, your respiratory etiquette, and cleaning surfaces regularly. Now, if, as a country, we are to relax measures, we have to be confident that persons will work along with us to ensure that there are no transmissions. And if we continue to crowd and we continue to not adhere to the physical distances and all the other measures that we have asked persons to put in place, it means then that we'll probably not be able to relax our measures. And so we appeal to you to prevent further transmissions by adhering to the measures that we have asked you to. Thank you.
Thank you, Dr. Nisbet. And thank you to Dr. Correa for her introduction and joining the health team, and also reminding our citizens that they still have a role to play, and they have to play that role for a very long time, which is to always remember to physically distance themselves from each other, especially when they're out and about. I'll now have Mr. Lyndon David, Superintendent of the Royal St. Kitts and Nevis Police Force, Nevis Division, make his presentation.
Good afternoon to all. Thank you very much for allowing me to once again to give some updates and some information to our residents right here on Nevis. We have conducted a number of patrols, and we have seen where, in most part, persons are adhering to the restrictions that were given according to Regulation 12, number 4 of the Emergency Powers Act 2020. We have made 10 arrests for breach of curfew, and we have 2 persons being charged thus far. We have had 7 persons being warned, and that's just from last night, and add for those that we have had over the period of time, which I will give next time I come back. We had reason to revoke 1 permit for someone breaching. Ask permission to do something, we expect you to comply regarding the curfew and the state of emergency. We will continue to enforce this very strictly, so persons who get permission from the police and you are not complying with the restrictions and the guidance inside there, we will take it back from you. We had a fisherman being warned. You were given permission to do certain things, do it, or else you will face the consequences. We had 3 farmers as well, were warned. Do what was instructed you to do, not otherwise. We had 3 persons who were informed that there will be summons. We had a large number of vehicles were stopped, persons engaged, and that takes us to 236. During the curfew, we're realizing that persons are still moving about. As normal, we have our crimes, and we have seen where 3 persons were arrested for crimes, and they were breaking offenses. At this time, we are encouraging persons to, because you will be away from your business establishments during the partial curfew, see how much security systems you can put in place. If needs be, communicate with the police and we can see how we can help you to enhance your security measures. We also received a number of fake emergencies. If boyfriend and girlfriend live separate places, stay where you are. Do not make up an excuse to travel to that location. You will be denied. And many of you have been. Wear your masks at all times as required by the regulations. Because of our observations, we will be looking at roadblocks. It may happen as soon as tomorrow to ensure that zonal restrictions are maintained. I will repeat, only the zone that is required to move about will move about. Rest of you stay indoors or in your yard. Finally, thank you to my hard-working staff, police officers, first responders, who are doctors, nurses. We have our NEVLEC personnel, and all the other persons who are taking part. We have Customs, Port Authority, private security guards, and all of you. We want to thank the law-abiding citizens who are strictly adhering to the restrictions and the guidance given. Those of you who have a challenge or difficulty to adhering to, we are welcoming you to be a part of the team that wants to see this virus do not spread any further in our country. More so on the island of Nevis, where we are reporting to you at this time. So please comply and please adhere to. As was mentioned earlier, shopping as if there will be no more food is not important. What we want you to do is to prevent the spread. We have seen the death toll around the world. So we want to continue to thank God for his mercies. And we want to encourage you to put your trust in him during this time. Thank you very much.
Thank you, Superintendent, for your update in regards to what's happening on the ground and what your officers are reporting. but I like that you also commended persons in the community who are doing their part and adhering to the rules and regulations set forth to help us stop the spread of COVID-19 in the island of Nevis and by extension the whole of the Federation. So I say congratulations to those who are doing their part, and we welcome those others who are not to fall in line and join us as we work together to prevent this spread. I'll now have Ms. Chanel Mills, Alexandra Hospital, make her presentation.
Good afternoon, everyone. Alexandra Hospital updates. Nevis Disaster Management Department donated 6 handheld radios and 2 base stations. One has been placed in the outpatients department and the other placed in the ambulance dedicated for COVID-19. This will help to enhance our capacity to communicate effectively. Our checkpoint, the Alexandra Hospital checkpoint, remains operational. From April 9th to 15th, 11 persons were seen and treated in that area. 7 persons were females and 7 persons were males. Just a few reminders for you, the general public. We're reminding persons to call ahead of arrival to the hospital if you have a cough, fever, or shortness of breath. The number to call is 665-5473. Once again, if you're experiencing cough, fever, or shortness of breath, call 665-5473 prior to your arrival. Upon arrival at the Alexandra Hospital, everybody is expected to state their business at the checkpoint and have their body temperature taken. Only persons accessing care at the hospital will be allowed on the compound. Our visiting hours. The Flamboyant Nursing Home has a no visitation rule at this time. Visiting hours at the hospital remains restricted. Visitation at the hospital is not allowed during the lockdown period. During a partial curfew, visitation will be only for immediate family members for a maximum time of 15 minutes, and only 1 person would be allowed in at a time. We thank you, the general public, for your understanding and your cooperation. We want to thank the following persons for your contribution to our healthcare staff during this time. Sol, through Reliable Motors, for discounted petrol for the healthcare staff. Delta Petroleum for discounted petrol also to the healthcare staff. TDC for their kind donation of drinks for nurses. Nevis Disaster Management for their timely donation of communication devices. Pastor Euclid Lawrence and their members of Crossroads Church for their donation of non-perishable food items to the staff. Also to Morning Star Egg Farm, Hosfords for their donation of N95 masks, and also to all our healthcare workers and supporting staff at the Alexandra Hospital, and as well as the community healthcare staff and their supporting staff, we say a big thank you.
Thank you, Ms. Mills, for that update from the Alexandra Hospital and for all the hard work that has been done at that level, and also the work that's being done at the public health level, and to all the contributors to the response thus far. I'll now invite Ms. Sandra Maynard, who is the Director of Social Services Department, to provide an update.
Good afternoon. So at Social Services, we have continued to offer our services to our elderly population. Our Hot Meals program has continued throughout the shutdowns, and our field workers who are assigned to the elderly in the community are designated to check in with the elderly clients by phone. To date, since the curfews and other limitations on movement, the department has assisted the elderly by providing letters of verification for caregivers who have to move around to attend to seniors living alone across the island. And to date, a total of 60 of these has been issued. The numbers, as a reminder, the numbers for counseling and emotional support in response to COVID-19 are 664-7269 and 665-9565. The counselors who operate from the Social Development Counseling Unit have been operating these two specific numbers. For requests for assistance and general queries, 665-2501 is the number being utilized. And as of yesterday, 15th April, 69 calls have been answered from the general public with respect to requests for assistance as a result of the crisis. An additional 26 calls were received in relation to registration for the Poverty Alleviation Program, again as a way of sustaining families throughout the crisis. For now, clients are being referred to the website www.stats.gov.kn, as there are no forms available at our offices. The number 665-2501 can also be used to report child protection or abuse matters. We remain cognizant that these issues will continue to arise and want persons to know that the officers will respond to emergency matters. There is a notice being circulated with regards to clients accessing their monthly food vouchers from area supermarkets. I would like to clarify that that notice was meant for Kittitian clients. We are trying to make similar arrangements for Nevis. So as of now, our clients should still come into the office for their PAP checks and their food vouchers. Thank you.
Thank you, Ms. Maynard, for the update from the Social Services Department in regards to the various services that are provided there, and for the clarification in regards to the food voucher and what will be expected in the future. So I expect Ms. Maynard will be back to provide another update in the very near future. Finally, we have Mr. Huey Sargent, who is the Permanent Secretary in the Ministry of Agriculture, who will give his update.
Good afternoon, everyone. Thanks to the majority of the farmers and the fishers who adhered to the protocols established for the curfew and their guidelines. The next round of curfews, we see that farmers and fishers may have an easier time, but you're asked to not abuse the process. We've had some instances where abuse has taken place and permissions would have been revoked by the police, but we still want to thank the majority of farmers who I believe and the ministry believes are well-meaning. We're still appealing to livestock owners not to just let your animals roam on a daily basis, because this is affecting our crop farmers. When these animals can't find the food that they want, they eat the food that we need. So we're appealing to use the cut and carry method, where the farmers are asked to go cut feed for the animals and take them to their animals and keep them in a confined space. We've also noted that there's been an increase in dog attacks on our livestock farmers. We're asking our farmers as well to continue to be vigilant. This is not a nice situation, but we're doing what we can to help alleviate. In terms of the abattoir, we will reopen to slaughtering operations beginning on Monday, but it will be on a limited basis because, as usual, we're trying to observe the necessary social and physical distancing protocols, and we still have to maintain the health of our staff. farmers will be notified as to our limitations, and we'll be asking you to be guided accordingly. And we're still asking interested backyard farmers we still have some more seeds that we would like to distribute to backyard farmers. So once our marketing division is open, that's in Charlestown behind the public market, seeds are distributed there on a daily basis. I do believe tomorrow, Friday, will be another opportunity for persons who have not collected to collect their seeds. And finally, we ask you, the general public, to support our farmers and fishers and eat local. Farm stands around the island, as well as the fisheries complex, are full of local and nutritious food. Food, nutrition, and security, food and nutrition security is key to the fight against COVID-19. Thank you very much.
Thank you, Mr. Sargent, for your update from the Ministry of Agriculture. And again, I will echo that food security is indeed key, and we need to eat nutritious food to boost our immune system, keep us strong. So please tap into your local markets, get your fresh fruits and vegetables, especially your dark green leafy vegetables and your ground provision, and try and eat your locally produced protein source, whether it's fish or beef or whatever your heart desire. It's best to get it from your locally grown sources here. We have come to the end of the presentation by all our presenters today, and so we'd like to open up the floor for questions from the media. Question from Shamika Budgeon of Von Radio. Dr. Cameron Wilkinson mentioned on Saturday on In the News, alongside the PM, that there are currently 15 beds available at Joseph N. France Hospital for COVID patients. How many thus far do we have available at Alexandra Hospital? Dr. Judy Nisbet will take this question.
Thank you for that question. Currently, we have 16 beds at the Alexandra Hospital that we have dedicated to COVID-19 patients. And we have an additional 8 beds at an off-site isolation area.
Good afternoon.
Good afternoon.
Monique Washington, Sinkers Nevis Observer newspaper. Just one quick question to Mr. David. When it comes to the partial curfew, are persons allowed to go to the beach on those days?
Ms. Superintendent, that's yours.
No. No one is permitted at this time. You are only permitted to deal with matters of emergency, whether it's medical or you have a plumbing issue. These things that need to be addressed urgently. Swimming is leisure, so until this activity is over, no requirement to the beach.
So in other words, during the partial curfews, everyone, once it's not your time to go out and shop, then basically you should be in your on your property, basically.
Yes.
What happens if you're caught on the road, though, during the partial curfews? Is there any punishment for that?
As mentioned earlier, persons are being arrested, persons are summoned, and depending on the explanation also, you are sent back home immediately.
Okay.
So after court action will be taken.
All right, thank you.
Thank you, Monique Washington. I have a question here from Shamika Budgeon of Von Radio. Can you give us a report on the first COVID-19 patient as they were officially confirmed on the 25th of March 2020? What then will be the next step as 14 days have actually passed? Please explain the steps or the processes. So we need an update on the first 2 COVID-19 patients that were confirmed here on Nevis. Dr. Nisbet will take that question.
Thank you, Shamika. The 2 patients are doing well. As a matter of fact, all 4 patients are doing quite well. I think you probably are alluding to whether or not the first 2 patients can be deemed as recovered. Now, for a COVID patient to be deemed recovered, there's a process, and we wait for 14 days. The person must be 14 days without symptoms, first of all, and then at the end of that 14 days, then we test. We do 2 tests, 24 hours apart, and they must then be negative for us to decide then that this person has recovered. The second patient is not yet at that point. So we don't count 14 days after the test has been done. We count 14 days after the person no longer shows symptoms.
Thank you, Dr. Nisbet, for that. That's been a burning question, the process in terms of when do persons reach recovery. And I'm hopeful that your response to Ms. Budgeon's question would have provided further clarity to the process. Vaughan Radio, Shamika Budgeon. Mr. Sergeant, are there any penalties or restrictions in place for cattle owners when their cattle are found in residential areas eating crops and causing additional damages? Also, if there is, can you provide a contact number that the public can call? Mr. Sergeant.
Good afternoon once again. The penalty really would be the cost of the damage. You're asked to call the Department of Agriculture. At this stage, it would be the Director of Agriculture, Mr. Randy Elliott. I'll just try and get his number so that we could 669-9042. You can call the Director of Agriculture and someone will come and do a damage assessment on your crop, and that damage assessment we would contact us if we know the owner of the animal. That owner is responsible for paying for the damage. If we do not know the owner, we can impound the animal. If it is not claimed, the animal goes through the abattoir and the funds generated from said animal would go to the owner who would have suffered the damage. And that is for Mr. Randy Elliott, who is the Director of Agriculture at this time, 669-9042.
Ms. Maynard, this question is for you. Will the Social Services Department be open to the public Monday, Tuesday, Thursday, and Friday of next week?
Yes, the department is open on all of the days that are not full emergency lockdown days. And on the days when we are not open, persons can call 665-2501.
Thank you so much, Ms. Maynard, for that. We've now come to the end of our question and answer segment. And I would like to remind persons to please obey the instructions of quarantine and isolation and the state of emergency, especially considering the social distancing aspect of the requirements and wearing a face mask or face covering when out during the partial curfew days. Additionally, you can protect yourselves and others by washing your hands often with soap and water, covering your cough and sneeze with a flex elbow, or use a tissue and discard and wash hands immediately. Avoid touching your face with unclean hands. Disinfect touch surfaces often eat fresh vegetables and fruits, drink lots of water, and exercise as often as possible. Always, again, practice social distancing or physical distancing, especially when you're out in the supermarket, drugstore. Please, we have to keep the measures that we have gained, all the work we've put in. Please let us not have any spikes on the island of Nevis and by extension the Federation. So please practice your social distancing. And of course, stay at home. If you don't need to move about, stay at home. And remember, practice these measures at home also. If you have any questions, concerns, or if you need to call, the hotline number is 311, the COVID hotline number, or you can call 661-5051. And please remember to sign up for the Nevis Health web app, and it's also now available as an Android app at your Google Play Store. So you can look for Nevis Health, and you will see the Android app. I'm sorry, unfortunately, iOS is not yet ready, but we are coming. I have an iPhone and I want to download the app myself. So the web address is kn.unhin.org. I am Nadine Carty-Keynes, and I thank you for joining us at this briefing today, Thursday, 16th April 2020. And join us again on Monday, 20th at 8 p.m. on Nevis TV. Thank you for viewing.